So I'm Katherine Ward from a company called Healthy.io. I'm guessing that many of you in the audience have undertaken a urine test at some point in your lives. So you'll know the drill. You go to the surgery or the outpatient clinic, you pick up a pot, you go to the loo, you take your pot filled across the waiting room, you queue, you wait, you hand it on to a clinician who will then dip it and evaluate what's going on. In even worse scenario, perhaps you have to pee into a pot first thing in the morning, screw the lid on tight, place it into your bag and hope to goodness that the lid is properly on when you hand it over then later in the afternoon. So what if you could take the test at home, pee in your pot at home, scan with your mobile phone and the results go straight to your electronic medical record? Well, that is now a clinical reality. Healthy.io is the first company to have been CE accredited for using the smartphone camera as a clinical grade diagnostic device. Urine testing is just the first of our products here, and we've taken 3 years to take this through to clinical CE accreditation to get onto the NIA fellowship, so I'm an NIA fellow, and we've recently closed a significant funding round that we're really wanting to invest here in the UK to partner with the NHS to really bring the value of this product to customers and consumers here in the UK. When The Economist wrote about us recently, they described us as leveraging in the rise of the medical selfie. So how do we plan to expand and bring the product more broadly to market? Well, we want to take evidence-based existing pathways. We're not suggesting anyone should dipstick when they wouldn't already dipstick. We're partnering with best-in-class global organisations, and Johns Hopkins, for example, have done our usability testing with pregnant women. And then we're wanting to really scale with full technology integration into the NHS. So the 3 areas that I'll just describe to you that we're focused on currently. One is around diabetes. So having your urine tested for albumin is one of the 9 diabetes care processes. It's the least well delivered of all of the 9. And in fact, for people with type 1 diabetes, only 51% of people nationally, according to the National Diabetes Audit, have actually had their urine tested. We have partnered with the National Kidney Foundation and Geisinger in the US to roll out a study that goes live next month, and with the Dutch Kidney Foundation and the University of Groningen in the Netherlands for a study that's going live in July. And we just recently signed a memorandum of understanding with Modality, which is one of the vanguards and one of the large-scale GP super practices at the West Midlands, but also here in Yorkshire now, to really roll out to see if we can take their baseline from the National Diabetes Audit up in time through using digital process. Pregnancy, women with hypertension have a high risk of preeclampsia. Actually, sometimes 3 outpatient appointments in a week in the last trimester. We think we can avoid at least 1 or maybe 2 of those by enabling women to test at home. And actually, this is rolling out at scale with Mohedet, which is one of the Israeli HMOs. And in fact, just Maccabi, which is the second of the largest and the largest of the HMOs, have also just signed last week for a further 40,000 person rollout. Oh, kit rollout, I should say. UTI is the other area of interest. Our first commercial engagement here is with UCL in London, working with people with multiple sclerosis who have a high propensity to getting a UTI, 4% of whom actually end up hospitalised with a UTI every year. There are also 5 million GP appointments and 210,000 A&E attendances from UTI. If we can actually tread that sweet spot between enabling people to be tested, which means that they're not being prescribed antibiotics with no test, which sometimes happens at the moment within the NHS, which is a stewardship issue, but also we're able to prevent the treatment room and appointment process that people have to go through. That would be a massive bonus. So we're talking to 111, we're talking to retail pharmacists about redesigning of that pathway. So I will stop there. It's a gallop through. What I love about working with the millennials is that they make you look like you could be one too. That's my email address. I'm afraid I have to dive off before the awards later, but please get in touch if anyone's interested in early adoption or engaging with me on any of those pathways or indeed any others that I haven't yet thought of. Thank you.